Ladies and gentlemen, from around the world, good morning, good afternoon, and good evening, depending on where you are in the world. I'm Professor Agnes Binagwahu, the Vice Chancellor of the University of Global Health Equity. It is my great pleasure to host and welcome you all to this monthly equity webinar that is part of the Ask Professor Agnes series. Every month, the Ask Professor Agnes series honors one of the United Nations International Day of the month. This month, we based Ask Professor Agnes on the World Day of Remembrance of Road Traffic Victims, which is commemorated in November each year by the United Nations. These webinars serve as a global platform to discuss important topics such as health professional safety, biodiversity, vaccine equity, mental health, and many more. They have helped global health fighters, such as colleagues and experts in different fields, to achieve impactful change through increased awareness based on evidence collected across the world that enable rightful actions and better planned and implemented actions. For today's important topic, we will discuss improving road safety using lessons learned from COVID-19. Today's webinar is also hosted by the Commonwealth Road Safety Initiative, which is an initiative that was put together by Commonwealth countries to implement the actions needed to reduce preventable death and serious injuries on roads of Commonwealth countries. One of our speakers, Jessica Trong, will tell you more about this initiative that I have the honor to be co-chairing to be the co-chair of the expert panel composed by 15 people. With us for the discussion, we have speakers joining from different parts of the world. It is my pleasure to introduce them to you. Let me first introduce you Jessica Trong, who is based in Europe. She is the Secretary General of Towards Zero Foundation, a charity working internationally for a world free from road fatalities and serious injuries. One of Towards Zero Foundation major program is the Global New Car Assessment Program, known as the Global NCAP. In her role, Jessica oversees programs and advocates for policy change that can enhance vehicles safety and road safety globally. Before joining Towards Zero Foundation and the Global New Car Assessment Program, she worked for the Transport Accident Commission in Australia, managing road safety program and public education campaign on a range of road safety issues, including the safe system and vehicle safety and technologies. Jessica holds qualification in psychology and science and is currently completing a PhD in road safety. Welcome to the webinar, Jessica. Our second speaker comes all the way from Australia. We have Ayan Cameroon, who has over 30 years public sector policy, strategy, and leadership experience in school and tertiary education, public health, drug strategy, transport, road, and road safety. Ayan was the executive director of the Office of Road Safety in the Western Australia state government from 2000 to 2015. He led the development of Towards Zero, the Western Australian government's ambitious strategy to reduce serious accidents by at least 40% in 2020, using the Safe System approach launched in 2008. The rate of road death fell from 11.3 per 100,000 population in 2000 to 6.4 in 2013. Ayan is an independent director on the board of the Australian New Car Assessment Program, chair of the Road National Road Safety Task Force, coordinating research, policy, and strategy advice to Australian and New Zealand ministers, and chair of the Organization for Economic Cooperation and Development and the International Transport Forum Working Group on implementing the SAFE system. We welcome to the webinar, Ayan. We also have David Ward, the president of Towards Zero Foundation, which is a UK charity promoting safe and sustainable transport. Towards Zero Foundation hosts the Global New Car Assessment Program, the Stop the Crash Partnership, and the Commonwealth Road Safety Initiative. David represents Towards Zero Foundation in the United Nations Road Safety Collaboration. From 2001 to 2013, he was Director General of the International Automobile Federation Foundation, which collaborates to sustain transport. He has served as Secretary of the Commission for Global Road Safety between 2006 and 2015, and chaired the World Bank Global Road Safety Facility from 2010 to 2012. Welcome to the webinar, David. From Rwanda, we are honored to be joined by Irene Bagayirwa, who is a public health specialist with 18 years of technical experience in coordinating health programs and disease prevention and control. She currently leads the Injury and Disability Unit at Non-Communicable Disease Division in the Rwanda Biomedical Center. Irene is a research-driven public health professional who have been published in many journals. She holds a certificate of public health learning from the Evans School of Public Policy and Governance at the University of Washington. Dear speakers, thank you all for being here with us today. And before we begin with presentation and discussion, I would like to share some logistical information with you and the participants. To ensure access to people who are hard of hearing, please click on the closed captioning of the CC button on the bottom of your Zoom screen to benefit from real-time text translation. Our panelists have also been prompted to be more descriptive of any image on the slide to accommodate persons with visual impairments. Also note that at any time, you can submit questions via the Q&A button at the bottom of your screen. Remember, every year, at least 1.3 million people die and as many as 50 million more are seriously injured due to road accidents around the world. Today, we commemorate the World Day of Remembrance for Road Traffic Victims, the United Nations Day to remember and pay respect to the many millions who lost their lives or are injured on the world's road. This day gives an opportunity to reflect on the tremendous burden and cost to victims, families, communities, and countries, and the way to mitigate and reverse this. This webinar will be focused on in-depth understanding of the impact of COVID-19 pandemic on road transport safety and draw lessons on how to reduce road traffic fatalities in the post-COVID era. We will also discuss where the world stands now. In the Commonwealth countries, over 210,000 people are killed in road accidents and millions more are seriously injured. These road traffic injuries are the leading cause of death for children and young persons between 5 to 29 years old. This is a huge problem, given that 60% of the Commonwealth countries' population is under 30 years old. For this reason, Commonwealth wants to prevent the loss of over 2 million lives by 2030. As a solution to this challenge, the Commonwealth Road Safety Initiative was launched in May 2019 during the UN Global Road Safety Week. To halve deaths and serious injuries from road crashes. This is in parallel with the UN General Assembly, which also has an ambitious goal to prevent 50% of the road traffic deaths and injuries by 2020 for the member states. During COVID-19, in certain places, due to the lockdowns measure and the decrease of road traffic, we saw some reduction of road accidents. And in other places, the fatalities on the contrary increased. For example, according to the US Department of Transportation's National Highway Traffic Safety Administration, early estimates showed a 7.2% increase in fatalities per 100 million vehicle miles traveled in 2020 compared to 2019. This happened despite a 13.2% decrease in vehicle miles traveled in 2020 compared to 2019. So we can see that even if there was a reduction of vehicle miles traveled, the number of fatalities, they increase mainly because of impaired driving, speeding, and failure of wearing a seatbelt. On contrary, in a city like Cali in Colombia, there was 70% decrease in traffic during the strict lockdown, with the number of injuries and deaths decreasing by 76% and 55% respectively. The fact that there was an increase in speeding during the lockdown shows in some countries a change in behavior due to drivers' perceived reduction of risks, giving the fewer vehicles on the road and the assumption of fewer law enforcements during the lockdown. On the 25 European Union countries who were able to provide data on traffic during COVID-19, there was a 36% average reduction in road deaths during COVID-19 compared to only 24% reduction the whole previous decade, 2010-2019. Despite lack of accurate traffic data in most African and Asian states, countries such as Nigeria reported a significant decrease in road accident deaths in 2020. Similarly, Japan in Asia recorded a 31.5% average reduction in motor vehicle collision and 30.8% average reduction in road traffic deaths from March to May 2020, compared to the same month in 2019. From this, COVID restriction led to reduction in traffic deaths at a low rate, but the rates could have been further reduced if traffic safety reluctance were avoided. As we observe this change in road conduct behavior and want to draw lesson of what happened during COVID-19 pandemic in matter of road safety, we should not forget what is already known. and united and merge all our efforts in designing better roads, policies, laws, and strategies to increase road safety. In the coming hour and 40 minutes, we will discuss how to concretely help solve the major challenges the world faced to keep us safe and prevent many young people and children from dying or being injured. Lastly, we also need to keep record of the change and impact on road safety during exceptional times, such as the current pandemic, to extract lessons to better plan for the future. Before we dive into this discussion, let me begin by asking each of our panelists to give their introductory remarks. Let us start with our first speaker, Jessica Truong, who will present what is the Commonwealth Road Safety Initiative. The floor is yours, Jessica.
Hello, everyone. Today, I'm going to give a short presentation on road safety within the Commonwealth. At the Towards Zero Foundation, we first set up the Commonwealth Road Safety Initiative to help address the actions that are needed to prevent a decade of deaths and serious injuries on the roads of Commonwealth countries. We know that road trauma is both predictable and preventable. Yet every year in the Commonwealth countries, over 500,000 people lose their lives, making it a key public health concern. The road safety performance of the 54 member states that make up the Commonwealth is extremely diverse. And we see some better performing countries having a road crash fatality rate that is under 3 per 100,000 population. But some of the worst performing countries have a rate that is well over 35. Unfortunately, what we're seeing is that in nearly all the Commonwealth countries, death and injury rates are rising rather than falling. And the death rate for the Commonwealth countries as a whole is 20.9 per 100,000 population. And this is much higher than the global average, which is 18.2. In recent years, the safe system approach to road safety has been widely embraced as the most forward-thinking and effective way to approach trauma reduction. The safe system approach to road safety recognises that as people, we all make mistakes that can lead to road crashes. And also as humans, our body has a very limited physical ability to tolerate crash forces before harm occurs. So when a crash happens and the speeds are too high, the body is likely to succumb to road fatalities and injuries. You know, when roads are unsafe without the right infrastructure measures, vehicles are unsafe and not being produced to safety regulations or equipped with available safety technologies, amongst other things, a combination of these altogether results in the fatalities and serious injuries that we're seeing on our roads. But to help address the road safety problems that we're seeing within the Commonwealth, we have at the Commonwealth Road Safety Initiative put together a set of 10 key recommendations for Commonwealth countries to implement as a matter of priority. First and foremost is for the Commonwealth to recognise road safety as a key public health issue and for them to put it on the Commonwealth agenda and start implementing the right actions to help address this predictable and preventable public health issue. The UN has set a target of a 50% reduction in road fatalities and injuries by 2030, and the Commonwealth can also adopt a similar target. You know, with the target and combination with effective leadership and implementation of evidence-based safe system measures, we can systematically reduce the risks in the road system, and this will go a long way in helping the Commonwealth meet the 2030 target. Because what is clear is that if the current road mortality trend continues within the Commonwealth, very few countries are projected to halve the mortality rates up to 2030. On the contrary, what we will see is an increase in the rates, and this is projected in at least 12 countries. as you can see from this graph. And this highlights the need for a target to help spur on further commitments and actions to help reduce trauma within the Commonwealth. What we know is that without further action, we are facing another decade of increased road fatalities and injuries within the Commonwealth. But the good news is that we have the solutions right now to be able to do something about it. We just need further commitment and leadership and greater implementation in order for us to help meet this target of a 50% reduction by 2030. Thank you for your time.
Thank you, Jessica. For this brief presentation. It's important, and we have learned much about this important initiative. Now, I would like to give a welcome to our second panelist, Ayan Cameroon, who will be sharing with us the situation in Australia, the challenges faced during COVID, and the lesson learned to reduce road traffic fatalities. The word is yours, Ayan.
Good morning, good afternoon, good evening, wherever you may be in our world on this day. Welcome. My name's Ayan Cameroon. I'm a trustee of the Towards Zero Foundation, a UK charity promoting road safety throughout the world. I'm also in my home country of Australia, in Western Australia, the state. I'm responsible for implementing road safety measures within government for our community. Can I acknowledge the traditional owners of the lands upon which we all meet today from across the globe and pay respects to elders past, present and emerging. Can I also thank Professor Agnes for the opportunity to join with you today in this webinar to share our collective experiences about road safety and what COVID-19 has meant, both positively and negatively, for road safety. In my case in Australia, as this first slide shows, last year, during the first impacts of COVID-19, we saw road deaths drop by 7%. That was associated with a drop in travel, as our domestic states, the 7 states and territories, the governments restricted travel. We restricted air travel, we restricted road travel. We restricted travel from capital cities into regional hinterlands. So there was quite a series of lockdowns and very severe travel restrictions. After those travel restrictions eased, this year so far we've seen road deaths increase by 5%. So last year, when domestic borders and regional borders and lockdowns began to first be implemented, we saw distance travelled, or our VKT, drop by 22%. Deaths dropped by 14% on our roads. But then conversely, and not unexpectedly, later in the year, with particularly regional areas hit the most, we saw our VKT, our distance travelled and our deaths increase rapidly again to the more historical trends. So we had that short-term public health impact of reduced exposure due to lockdowns gave us a reduction in deaths. But the biggest impacts, both positive and negative, were felt in regional road trauma. The second slide summarises some of the things we've seen in Australia. As I said, particularly that change in exposure, with regional being impacted much more than metropolitan. We saw, particularly in metropolitan areas, we saw a greater use of private motor vehicles and bicycles, both during, and that tends to be remaining still today. Use of public transport, trains and buses has returned to very good levels, but we've still got a large, still continued use, greater than we had before, of both motor vehicles and bicycles. And bicycles is very good, but congestion is certainly obviously adding to our emissions and our congestion on our road network. The federal government introduced a tax write-off last year to stimulate the economy, an instant asset tax write-off. That meant many businesses and small business owners could buy new vehicles and write off the tax benefits in 1 year rather than over several. It gave us an increase in new vehicle sales, light commercials particularly, and that saw a greater injection of newer, safer vehicles into our market. There was also a lot of stimulus money provided for infrastructure projects. One big area of those came into regional roads, which is a very traditional problem in Australia: low volume, vast distances, and generally very poor road quality. But in my home state of Western Australia, we saw a safety program, a very simple program, sealing the edge, the bitumen tar edge of the road, adding a metre of bitumen to the side of the road, adding white lines, adding audible tactile rumble strips, and often with wide audible centre lines. That's seen an increase in safety, it's seen an increase in regional employment, and an increase in boosting regional economies. So the money being spent quickly has benefited not only safety, but it's benefited those regional communities. The final slide, slide 3, is a case study there that just shows a program that we'd established. We'd done the research and development for. We were funding it at about $20 million a year to do that program. We've got a vast network. We need to treat 18,000 kilometres. We had a 44-year program at $20 million a year. We estimated if we got $100 million a year, we could bring those benefits down to 9 years, i.e. 35 years sooner, saving over 2,000 people from being killed or seriously injured with those benefits, those compounding savings occurring. A very long program for us. One of the benefits of COVID, that stimulus money, has now meant we have $660 million going into that program that'll be spent by June 2023. The benefit cost ratio is about 4 to 1. The huge savings in bringing forward those benefits for our community are substantial, and it's been one of the real positives out of COVID-19. Thank you.
Thank you, Ayan, for your remark on what we can draw from COVID-19 to reduce road traffic fatalities and also opportunities. We will discuss that later. Allow me now to welcome our third panelist, Ayan Cameroon, who will present on the situation in Africa with a focus on Rwanda, challenges faced and lessons learned to successfully reduce road traffic deaths and injuries. The floor is yours, Ayan.
Good morning, everyone. My name is Ayan Cameroon. I'm from Rwanda. I'm the Acting Director of Injuries and Disability Unit in Non-Communicable Diseases Division under the Rwanda Biomedical Center. The Rwanda Biomedical Center is an institution of the Ministry of Health in charge of implementing policies and programs of the ministry. I'm happy to present about improving road safety using lessons learned from COVID-19. Globally, 1.3 million deaths occur worldwide due to road injuries, according to the WHO report of 2019. And among those injuries, 93% of them occur in low and middle income countries. The African continent average road fatality rate is equal to 26.69 out of 100,000 population. And Rwanda accounts for 29 out of 100,000 inhabitants. In regard to the improvement of road safety in relation to COVID-19 in Rwanda, the present graph shows a trend of road injury cases that happened in pre-hospital settings of the city of Kigali in 3 consecutive years from 2019. It shows a significant decrease in April 2020 and July 2021. We assume that this reduction is attributable to COVID-19 related lockdowns, where people movements were restricted. There is a long list of best practices in regard road safety and road injuries prevention in Rwanda. This goes from primary and secondary prevention with more focus on community awareness and specific law enforcement. All of these best practices are backed up by a strong leadership and political will that emphasizes continually that safe, high quality and compassionate care is among the top priorities within the country. The good coordination, as well as active involvement of all the concerned actors, especially local authorities, security organs, multi-sectoral committees, and others, play a great role in road safety improvement. We are now, where we are now is just to sustain or maintain all that we have achieved and promote specific innovations, aiming always the highest level of attainment. This is the reason why the homegrown solutions concept remains promoted in Rwanda. The best bias interventions in regard to road safety, such as putting in place safe speed measures, signposts on roads, regular road maintenance, speed control cameras. All these should be promoted locally and in the region, of course. Also, it is important to bear in mind that awareness for behavior change is key as far as road safety is concerned. Thank you.
Thank you, Irene, for depicting the situation in Africa, especially in Rwanda. Before driving to the Q&A, allow me to welcome our fourth and final panelist, David Ward, who will be presenting on the global plan for the decade of action for road safety and what we can do to achieve it. A plan that the UN member states have signed on. The floor is yours, David.
Firstly, I'd like to thank very much Professor Agnes Bingawao for the opportunity to contribute to this webinar and to tackle the very interesting question, what are the lessons that we can learn from COVID that should be applied to global road safety? I think there are three lessons that stand out for me. One is it's essential to have leadership. Strong leadership is vital to tackle the huge and complex challenges of road safety. Secondly, we've got to deploy vaccines. And it may seem a slightly inappropriate metaphor, but actually there are vaccines for our road injury crisis, which in some ways parallel the really important role that vaccines have played in tackling COVID. And then the other really critical thing is concentrating relentlessly on implementation. And we have progress in all these areas, which this first slide highlights, which is that on the leadership level, globally, we've got the best ever, strongest ever mandate for road safety action we've ever had, with a very good declaration that was agreed in Stockholm by ministers in February 2020, backed up by UN General Assembly resolution last year, which endorsed the idea of a decade of action, together with a target to halve road deaths and serious injuries by 2030. And next year we have a very important high-level meeting in the UN General Assembly to look at the implementation process. On the vaccine side, we certainly have a very good knowledge now of what works in road safety. We understand the benefits of applying the safe system approach, which is a holistic, integrated strategy, which tries to deploy all of the actions needed in a concerted way to tackle road injury. We have evidence-based measures that work well in relation to roads, vehicles, and users. And we also need to apply what is called the avoid, shift, improve paradigm, situate road safety in the wider challenges of sustainable transport. And on implementation, we have a global plan, which has just been adopted, which gives a very good framework for all countries, all UN member states, to tackle road safety over the next decade. And we've got a wider vision of how we want to achieve ultimately a world free from all road traffic deaths. So that's the framework I want to just highlight in my short remarks this morning. On the global plan, this slide just in one set of images captures really what the global plan is trying to do. As I mentioned, it's based on the safe systems approach. This puts reducing the risk of injury at the center of any road safety strategy, but it suggests strategies that simultaneously act on vehicles, on roads, and on road users. So it's a holistic, integrated approach, which is something that we've got to do. We've got to avoid piecemeal interventions that don't really tackle the broader picture. So that's in the what to do category. Then on the how to do it, which if you like is more focusing on the specific interventions, the vaccines if you like, there are a range of initiatives highlighted there. I particularly want to highlight speed, which is illustrated with the 30 kmh sign there. Speed is an overarching cross-cutting feature of road safety. In any conceivable road traffic incident, less speed means less injury risk. So it's a big opportunity if we can generally get speeds down to make a big impact. There are other important issues there, the importance of technology, bringing forward some of the best technologies and so on, financing, legal frameworks, it's all there. And then finally there's the how to do it, which is who are the partners who are going to make this work. And that has to be a combination of governments clearly taking their responsibilities, but also private sector, civil society playing a key role. Then I'd just like to highlight this paradigm from sustainable transport, which is particularly motivating the environmental side of transport, but is just as relevant to road safety, which is that in order to bring about the change we need to get the 50% reduction by 2030 and progress beyond that, we need to both avoid, shift and improve our transport systems. Avoid unnecessary transport, shift to safer, cleaner forms of transport, and improve, that is, harness the technologies and so on that can help make our systems more sustainable. And then finally, that should all fit into an overall vision. And this chart illustrates what's called backcasting, which is an approach to policy development where you envisage where you want to be, where your destination is, and then you work back from that. You implement steps in a very careful strategic process by doing your baseline analysis, working on your solutions, but having a very clear idea of the destination you want to work towards, and then plan the steps and the interventions that will deliver that over the planning time frame, which in the decade case obviously is 2030, but for our more ambitious goal of 0 fatalities, that's 2050. So I hope that gives you some idea of the challenges that we face in the decade ahead, but also the huge opportunities to halve road deaths and serious injuries and really make a big difference in making our transport system inherently safer. Thank you very much.
Thank you, David, for this recall on the global plan for the decade of action for road safety and what we can achieve. So thank you all the panelists for insightful presentation. I remind the audience to send your question through the Q&A section, and that all questions that will be on the chat at the time we will close the webinar and will not be answered by the panelists because of lack of time. They will be answered within a week using hashtag Ask Professor Agnes on Twitter, Instagram, and Facebook. So the first question is sent by Bonnie. Bonnie, a supporter of UJG and member of our advisory, Vice Chancellor Advisory Board. She asked, and the question is for you, Irene, are eye examination and corrective eye glasses required for truck drivers, passenger bus drivers, and all drivers license holder in Rwanda and beyond, and also our truck drivers and long distance bus driver require to have emergency first aid training and first aid kit on board. Irene, the floor is yours.
Okay, thank you very much for the question. Yes, there is a law of 2002 regulating road traffic and an official gazette of 2003 where it is stated that all vehicles, including the transborder trucks and the buses, trucks and buses must have their first aid kits. So it's mandatory for all drivers to have it. So for eye and hearing examinations, the same law has also provided guidance on that. So there are required measurements as stated by law that has to be respected before a person is granted a driving license. So actually there is a revision of that law because it dates from 2002. It is being revised by the ministry in charge. So once approved, it will replace the existing one, and then we start enforcement. Thank you.
Thank you, Irene. The next question goes to you, Jessica. Do we have the solution right now to help reduce road fatalities and serious injuries?
Thanks.
The floor is yours.
Thanks, Agnes, for the question. I do believe that in road safety, we do have the available solutions to help us meet that 2030 goal of reducing road fatalities and injuries by 50%. You know, the solutions we have at play are some of the ones that David showed on one of his slides from the global plan. It's about reducing speed limits to a level so that we know when a conflict does occur, people are less likely to suffer fatal or serious injuries. It's also about improving the road infrastructure and improving vehicle safety. So a lot of these measures are known, but what we're lacking at the moment is, once again, what David touched on, leadership. We haven't got enough leadership where people are committing to further actions and further investments, and also greater implementation of what these evidence-based solutions are. So there's lots of those solutions available. We just need people to implement. So in this next decade, where we call it a decade of action, we really need to see that action. We really need to see that implementation.
Thank you, Jessica, for this answer. There are other questions. Notably, there is a question in the chat from Jean-Jacques who say, I don't understand well the effect on COVID on road safety. Why we took this opportunity to link that to COVID is because due to the lockdown, we should have seen around the world a decrease because there is less car on the roads. However, in some part of the world, it was not the case. So it makes us reflect that we need to really insist and found strategies for protecting life of peoples and avoid injuries, especially for our children and for our the youth. The next question is for you, Ayan. What are the key learnings from your regional road safety case study, particularly for those countries which may have we should have no extra funding at this time? You told us that you got the chance to have during COVID more money for road safety. What is an exception? So what can other countries learn from you and also do when they don't have more money available?
Thank you, Agnes, and that's a very good question because it looks like we are very privileged and perhaps from a difficult situation in COVID, we've ended up with a lot of money for road safety, and I do appreciate not every country
is in that situation. A little bit of context. We are a lucky country in many ways, but we do have a big regional divide in road trauma. So I think you read out in my introduction or background that, you know, our fatality rate in Western Australia has dropped. It has dropped dramatically, but the capital city of Perth, it's about 4 to 5 deaths per 100,000. In regional Western Australia, it's about 20 deaths per 100,000. So some of those tables of countries' performance, we have equivalent performances on our regional roads. So, and those killed and seriously injured rates range from 73 people killed or seriously injured per 100,000 to 219 per 100,000. So our regional road trauma is a big issue. The difficulty is it's a vast country and we have very low population. So our ability to implement treatments is very difficult. My messages and my hopes for other countries to learn from our example would be that we've been working at this problem for, well, we've been funding it for about 9 or 10 years, and we never thought we would see this rainy day with funding. But our research and development, we traditionally were, if you want, chasing lightning strikes. So we would have a crash on one part of our road, and we've got 175,000 kilometres of regional roads. About 18,000 kilometres of those are highways and major networks. With the crashes, they were occurring supposedly randomly. So it wasn't that we could go out and just neatly apply a treatment in one spot or one location. And without a lot of money, we were finding it very difficult. So the learning has been not only where to go, and we've moved to a proactive risk-based approach. So we've began to analyse the features of our road network and begin to sort of look at the parts of the infrastructure that were of different quality. For all countries, what we're doing, a metre of bitumen, a rumble strip, a white line, they are relatively low-cost treatments, very low-cost treatments in terms of road building. And for us, the methodologies have been refined. How we apply them, how wide that piece of bitumen is, has all been examined closely, and we've adjusted that to get the best return. When we started, our benefit cost ratio was about $1.60 for one. So every dollar we were spending, we were getting about $1.60 benefit. We've now refined that methodology to be about 4 to 1. So for every dollar we're getting 4 back. The other thing I would say to countries, apart from the money and looking at the method, is also to begin to collect data and widen the criteria and include greater definitions of crashes. We were so much historically captured by, like many countries, police reports on culpability, blame, and legal responsibility. We found as we got speeding, drink driving, and seatbelt crashes down, we still had an intractable problem that wasn't getting any better. Why? Because people are tired, they get distracted, they get bored, they make a simple error, and they put 2 wheels off the bitumen onto gravel and lose control of the vehicle. So for us, my message is, you know, funding can come along and there are opportunities along the way, but this is very low cost treatments. And I think the most critical thing is the research, the development, the building of your data, because if you keep collecting data on the same things, you will end up with the same solution. So our learning has been to change that data that we're collecting and broaden our approach. Thank you.
Thank you, Ayan, for this comprehensive answer. The next question is for you, David. If you had to name one major policy priority for the new decade of action, what would it be?
Well, thanks, Agnes. I think, as you can see, the global plan is very comprehensive, and it's always difficult to single out, you know, is there a sort of magic silver bullet? Well, I think it's always dangerous to look for one single solution. But the nearest thing we have in road safety is tackling speed. And it's been mentioned before, Jessica mentioned it, and I mentioned it in my earlier presentation. And that's because in any crash environment, the amount of kinetic energy you have, how much speed, that is the injury factor. That's what's causing the damage. And if you can reduce speed in any condition, you're going to reduce the associated risk. So speed is really a big overarching opportunity. I think, though, one of the ways to look at this, though, is to realize that we don't just solve speed by simply posting speed limits. There is plenty more to be done. You can do it, traffic calming, better road design can intrinsically lower the risk of higher speeds. There are vehicle technologies now, particularly important for fleets. You can use technology to control the speed of the vehicle to make sure that it's obeying speed limits. Of course, traditional enforcement is really important, and building public acceptance. So you need a multiple range of instruments tackling overall levels of speed. But the plain fact is, if we, over the next decade, could systematically reduce speeds around our networks in all countries and all circumstances, that would be the single biggest factor in terms of hitting the target. So I think speed is vital. And of course, the other thing about speed is it has positive linkages to wider issues of sustainable transport. If we're trying to look at climate change and improving fuel economy, for instance, then lower speeds help there too. So there are a lot of positives for making speed a very strong focus of our work over the next decade. Thanks very much.
Thank you, David. We can see that the solution is in our hands and in the hands of enforcement, because those accidents kill so many. Irene, next question is for you. Over the years, Rwanda has implemented many road safety regulations, including speed regulation. David was just expanding on that. Can you tell us more about the impactful change that have been observed since their implementation? Irene, the floor is yours.
Yes, thank you. Thank you for the question. Yeah, there is a big impact in terms of behavior change, because actually Hello?
Yeah, we are losing you.
Can you hear me? Okay, can you hear me?
Yes, it's better.
Yes, actually we can say that there is a big impact, because in terms of behavior change among the population, we see that people are aware of the inconvenience or consequences of overspeeding, and we have different regulations that are being followed up. Like actually, we have different cameras on roads, and people have reduced speeds when they are driving. People are respecting speeds that are mentioned on signposts, and even on respecting the speed that are just in the cameras, because we have signposts of 40, 60, and people are respecting by reducing speed while driving on road. Also, we have the main category which is affected, like motorcyclists. They are respecting laws, because no person can go on motorcycle without wearing a helmet. And for buses, and no person can go to bus without fixing a seat belt. So there is a big change in terms of behavior. And also there is measures regarding car control, and each car has to pass by the car control to be able to know if the car is in a good status. So there is a big change that can be maintained and sustained. Thank you.
Thank you for this answer, Irene. So as David was saying, speed, you control it, you go for improvement. The next question is for you, Jessica. How important is leadership in reducing road trauma?
I think leadership within road safety is vital in helping us get to that 2030 goal and beyond, like to zero by 2050. Leadership affects every facet of road safety. It's usually leaders, and we're not talking just government leadership, we're also talking about leadership within private sector and private companies. It's often the leaders that decide whether or not to invest in road safety. They decide on what the priorities are. So if we sort of look at road safety as a public health agenda, what we're seeing, a lot of countries haven't actually set a 2030 target of a 50% reduction. And that requires leadership at the top government levels to say they want to commit to making road safety a priority and, you know, concurrently investing the money and the time and staff efforts in trying to improve road safety. And similarly, from a private sector perspective, David touched on the issue of fleet management. We need corporate sector to recognise road safety and vehicle safety as a key issue and implement the right road safety and vehicle purchase policies to ensure that the vehicles that they're purchasing are safe, implementing safe driving policies to ensure that their staff are also safe on the road. So leadership sort of transcends all the different levels of the road safety solutions that we're pushing for. Without that key ingredient, we're going to find it really difficult to get to that 2030 target. We really need that leadership, the commitment, and that followed by the implementation of the actions that we're sort of discussing in this forum.
Thank you. So leadership is important. And also the role of citizen, because the citizen talk to their leaders. So each and every one, we are concerned to put that on the table for discussion and for improvement. Thank you, Jessica. Ayan, the next question is for you because it's about Australia. Australia has adopted a safe system approach to improving road safety. What changes are you seeing that other countries may learn from?
Thank you, Agnes. I think I'll pick up on your comments just then around the citizens and Jessica's comments about leadership and David's comments about speed. It's all about change management. And as someone that is senior in government, but I'm not at the top and I'm not elected, but at the end of the day, citizens do elect governments. And so decisions that governments implement, if they're very unpopular, they can be reversed and governments can be kicked out. And I think there are some challenges in road safety. I'm going to summarise by saying in the safe system approach, the hardest thing that we have seen is to unlock and unweld our community from a view that we're all individually responsible and it is idiot risk takers that die on the roads. And that is, we are locked onto that, and that's good in that we hold ourselves accountable, but it's been very difficult to unlock other solutions, speed being a very good example. If we want to lower speed limits, that's seen as a penalty to people who drive well, to make up for those who can't drive properly. So we need to work our leadership around change management, engaging the community, participating in decision making. But the fundamental switch that we've been trying to throw is, how do we move people from blaming users and blaming users for all risks that happen on the road versus just relaxing and accepting that each and every one of us is a human being and we're not perfect. We do make mistakes, and so we need the system to encourage us and nudge us to make the right decisions and use our road network safely, but also, and not or, but and, when something does go wrong, we need the speed, we need the vehicle, we need the infrastructure to give us some more protection. And our paradigm shift, if you like, has been, and I'll finish with an example of within our road authorities and engineering authorities, typically before we started the safe system journey, it was, I built this road to the standards. The humans aren't using it properly. Get the humans to use the road properly and it'll be okay. An example of that was on a country highway. We installed a drainage sump or a large pit. We put a protective barrier in front of that pit at the side of the road. But immediately before the barrier and after the barrier were trees, very mature trees. They were a very big hazard. When I asked the engineers, why didn't you protect the motorists from the trees? The answer was, we installed the sump. That's our responsibilities. The trees were there. That's the motorist's responsibility. So we had this divide. Now, increasingly, we're doing what David was talking about. We're backcasting. And when we build a new road or we look at an intersection now, what we're working backwards from is no harm, 0 death, 0 serious injury. We don't know how to do it often, but our whole approach has changed to that safe system now because we ask the questions, what do we think we would have to do to make this road safe for everyone all of the time? By the way, we're not achieving it, but we are significantly changing our practice.
If I get you well, Ayan, we need to put the communities where the road will pass through, the engineers, the people who pay for it, and the medical team, the civil society fighting for road safety, all together before accepting the proposal of the people who build the road to start.
Correct, 100%.
Okay, so this is an approach that is going to be time consuming, but will save so much life. The next question is for you, David. Is it realistic to aim for 0 road death? If so, how realistic it is?
I think it's a kind of must. You know, when you stand back, you think, why do we tolerate this level of death and destruction that is preventable and predictable? So really the question is almost as put back is, how on earth can we not strive to eliminate road deaths when we know there are so many measures that we can take? I think it is important to be realistic in our timescale. So that's why the UN target is to have a 50% reduction by 2030. But that, of course, is simply an interim target towards this goal, which they have suggested for 2050, of reaching a point of elimination. And I think if you look at past experience, countries have succeeded. 50% reductions are not impossible. It is challenging, it is demanding, it requires all the things that we've been talking about, leadership. And I think the point you and Ian just discussed, leadership with engagement. It can't be top down. It's got to be leadership based on listening and gaining a sort of permissive environment for the kind of interventions we need. But I'm an optimist about all of this. And in a funny way, back to your key point about, look at the response globally to COVID. I mean, it's not been perfect by any means, but there has been an extraordinary public health response. For example, developing vaccines so quickly and so on, and a willingness to really change a lot about how we go about our daily lives. Of course, a lot of that was it's been very challenging, very difficult, but it shows that if the international community and if governments and the communities act together, they can achieve quite strong public health results. So overall, I remain determinedly optimistic, realistic but optimistic. And in the end, I'm always recalling Martin Luther King's comment about the urgency of now. We've got to get on with this. Another comment that Martin Luther King famously said was, the arc of justice always bends towards freedom. Actually, I probably got the quote slightly wrong, but to me, to get that quote in a road safety, I think the arc of road safety bends towards 0. That's what I think.
Yeah, that's the arc bending to justice. And,
Yeah.
you know, it's an injustice to lose your life because you had to go from point B to point A and you find somebody who didn't respect the law, or the law, as Ayan say, is not built in sound manner to protect the user, not only the people in the car, in the bicycle, in the motorbike, but the people who are walking that have also be a part of the equation. And for this, there is a question coming in the chat from Aline, saying that there are many questions. Let's take the one from Aline saying that, so she say where she's studying, and she's glad to follow the webinar. Thank you, Aline. It is true that road safety is a big health issue that leadership and health professionals have to tackle. My question goes to Irene. According to the reduction of road deaths that was observed in 2020 during COVID outbreak, the COVID pandemic is still with us, unfortunately. What are the new recommendations do you have to draw from 2020 to improve road safety in Rwanda? Thank you so much. Irene, could you take this question?
Thank you, Alan, for the question. Yes, it's about the recommendation on what we have learned from the COVID-19 status in terms of reduction in cases of road traffic accident, isn't it?
Yeah. And she asked, what lesson can we draw for the future in Rwanda? I think Irene frozen. We will answer that question later on.
We cannot raise movements for the population, but what we need is just, as we have as I mentioned, we have a strong leadership, we have laws which are there, so we need to keep observing some laws that are in place, respecting laws that are in place, and on the side of health promotion, you have to keep making people aware of the problem, the burden, and inciting them to reduce their behaviors that can maybe be a cause of life lost. So we need really to strengthen the measures which are in place, because we have main measures that has been put in place, and we have the new best buy interventions that are in place. We need to tackle the side of road users, and then environment, of course. We have to take into consideration the environment, but also there are measures that focus on improvement of roads. So all this combination of measures have to be respected on the side of the government, of course, and on the side of the road users, so that you can have common understanding of issues and see ways of tackling that issue. So it's the responsibility of each and everyone to reduce the burden of road traffic injuries. Thank you.
Thank you. I hope that Aline, you get your answer. If not, the chat is there to ask more or to dig more in the question. Ayan, this question is for you. During COVID-19, messages of prevention were used to communicate to the public through art, media, and other mediums. Can you think of innovative way to communicate message of prevention for road safety, for road traffic injuries or death, as it was done for fighting COVID-19? So, in fact, I think I misread in the beginning, all those way to give message, meaning art, etc., media and other medium were used for COVID. So does this inspire you of other innovation to fight road traffic injuries and deaths? Ayan, the floor is yours.
Thank you, and that's a great question. Short answer is that yes, it does inspire us in terms of mediums and methods. I think what we're still searching for is some of those communications that will resonate and the messaging that we need to provide. We've tried lots of different things, for example, in speed or in drink driving or in purchasing safer vehicles, but we still have a disconnect between my perception of risk and the behaviours on the road. So we've certainly been inspired by COVID. A lot of things have inspired us that I'd love to have in road trauma, not only messaging, but for example, the ability of our country, and I'm sure many other countries now, to report daily on levels of vaccination, to report daily on hospitalizations, to report daily, sadly, on deaths, has been an absolute inspiration. In my country, it probably would take us 6 months to report serious injuries as all of the various emergency departments collate their patient records and they are centralised and checked and all the rest of it. So we have a lag in road trauma reporting. Deaths we tend to report without any analysis. So COVID has inspired us not only in communications, but also in data and how you share data with the community. But I think what we still lack, and you know, there are many creative organisations, and Jessica's from the Transport Accident Commission originally in Victoria. There's many good examples of wonderful communications. So we are using social media a lot more. We are using paid advertising. But I think what still eludes us is what are those key communications. We've had many successes with our communication messages, but in the area of speed, I still think we're searching for some of those messages that will resonate and encourage the community to see speed as a vaccine rather than as a penalty.
Thank you, Ayan. So that's a great idea. I can see that in many countries, there is a daily report with numbers about COVID new infections and COVID new death. That's true that if you are doing so for road safety, people will have more, the awareness will be big, especially if we add the age of those who die, because we know that the majority of those who die are the children and the young people, those human beings who have all their life in front, ahead of us and who lost everything. So good things to propose for the Commonwealth initiative, but Irene, it's a good thing for the prevention across the world. Maybe we can start and see the impact it has. Fantastic, good idea. Thank you, Ayan. David, there is a question for you. We all know that alcohol is a major risk for crashes. And this question has been asked by Ray. And I can expand on that. What other factors that contribute to road crashes that are unknown to the public and should be advertised and discussed more. The floor is yours.
Sure. Well, of course, alcohol is right up there with speeding, not wearing seatbelts, not wearing helmets on motorcycles, amongst the key risk factors that the WHO in particular have highlighted. And all of the things we've been talking about, the campaigning side, the communication side, better enforcement, all of those things are essential. There are some technology things to look at. In fleets, you can have alcolocks. It's perfectly possible now for the major global fleets to have devices in the vehicle that make it very difficult for the drivers to be driving whilst intoxicated. So again, applying a sort of safe systems approach, we want to look at all the different ways these measures can come in. Regarding new areas of concern, we are always concerned about areas of driver distraction, mobile phones and so on, adding to the risk that drivers are not paying attention. So I think there's no avoiding constantly reassessing the challenges we face in terms of the way in which poor driver behavior can become a serious problem that needs addressing. But I think it's absolutely right to highlight alcohol as a major issue. And I think that we have to get back back to the issue of particularly on how to make enforcement work well. And that's going to be quite a challenge. Again, it comes back to community engagement. If you have strong support for stronger enforcement, it's going to work more effectively. That requires the kind of communication campaigning that Ian was talking about. We also have to be frank, we've got to tackle areas of petty corruption sometimes that interfere with good enforcement. So it's a complex challenge, but it's certainly one we have to put high up on the agenda. Thank you.
Thank you, David. Irene, there is a question for you here. As per your presentation, you highlighted that Rwanda roads traffic fatality rate is 29 deaths per 100,000, which may be ranked as higher considered to some other African countries. Despite all the effort that you mentioned above, what do you think is the reason for that? And what do you think should be the best way to reduce the burden of road traffic incidents in Rwanda? So 29 deaths per 100,000 people, is it higher compared to other countries in Africa? And if yes, what to do?
Yeah, thank you very much. The first reason may be the increase in motorized vehicles and the urbanization, of course, because all of this goes together with people behavior and road user behaviors, of course. So improved infrastructure, for instance, tarmac roads, sometimes they are the cause of overspeeding, because when the road is good, people tend to overspeed if there are no measures to control the speed. Also, I can say that the healthcare system is still improving. So we need to strengthen what we have already as measures, mostly in relation with human behaviors. We have emphasizing about it. The increased infrastructure in terms of quality and numbers can also reinforce the measures that are in place. And we also need to reinforce the health system to provide quality care to injured people. And of course, make sure that we are providing quality rehabilitation for those people who are being disabled due to road traffic accidents. Thank you.
Thank you, Irene. Jessica, there is a question to you from Adeline. She would like to know about how poor and developing countries can maintain road safety and reduce road injury as a goal for 2030. And in fact, due to, I guess, because there is something I cannot read there, but I guess that it's due to the financial impact of COVID-19 that has affected those countries.
Yeah, thanks, Agnes, and thanks for that question. And obviously, investing in road safety solutions does cost money, but they don't have to be expensive options. One that we've spoken about a lot in this session is around speed management and appropriate speed limit setting. So that is a cost-effective solution and is an easy to implement solution a lot of low middle income countries can do right now that would make a big impact on their road safety in their country. And it doesn't necessarily cost a lot of money. And especially in low middle income countries, as they are becoming more motorized, as they're further developing their road infrastructure, they're building new roads, they're seeing more new vehicles come on the road, there are things that the government and the community can implement in terms of rules and regulations, ensuring that new roads are built to a safe system standard. So making sure that you're not introducing new risks into the system. Same with vehicles, as countries become more motorized and there are more and more vehicles on the roads, we can make sure that they adhere to safety regulations, making sure that the cars that are entering into the road system meets safety regulations and that they're equipped with the best available safety features. So those are not expensive options, but they do require time to penetrate as well. So when we talk about meeting the 2030 goal, especially in terms of road infrastructure and vehicle safety, we need to start implementing some of those solutions right now. And I guess on the flip side, where you talk about implementing and improving road safety costs money, on the flip side, we also cannot afford not to improve road safety. The cost of fatalities and serious injuries, besides the emotional and personal toll it takes on us, there's the economic side. It costs us way more in dollar terms not to invest in road safety. And in terms of COVID, we're hearing around the world, like when COVID was at its peak, hospital systems, the healthcare system is buckling under the weight of all the COVID cases. We don't need to add to that burden of the healthcare system by adding more road trauma victims to that already overburdened health system. So by improving road safety, we can also alleviate some of the cost and burden that is being placed on the healthcare system, which is already at like breaking edge in a lot of countries trying to deal with COVID. So I think the takeaway from that is we cannot afford not to invest in road safety. And that goes for every country in the world.
Thank you for your passionate answer, Jessica. Ayan, I see that you have raised your hand.
Thank you, Agnes. I just wanted to add to the question that David got, and I perhaps interpreted it slightly differently. And the question, as I recall, was along the lines of what are some of those less obvious or more hidden problems in road safety? And one that stands out for me, given the discussion on speed, is the dangers of low-level speeding is not well understood, certainly in my country and many other countries. Let me illustrate. We tested our 60-kilometre-an-hour urban distributor or high-volume roads, and we found that we looked at speeding 0 to 10 kilometres, 10 to 20 kilometres, and more than 20 kilometres over the speed limit. The public health harm in terms of crashes on those roads, 1/3 of the problem was people doing more than 20. 1/3 of the harm was people doing 10 to 20. 1/3 of the harm was many more people speeding by a little bit. And Dr. Jeffrey Rose, and I hesitate to say this because you're a public health professor, but I think I'm right in saying that Dr. Jeffrey Rose described this as the public health prevention paradox. In other words, a little bit of a modified behaviour by all of us adds up to a significant community benefit. So the challenges we've got is when individually, I don't think there's any great harm in doing 5 kilometres over the speed limit. I don't think that's a big problem. And from my individual risk, it may not be the biggest problem. But when a lot of people in my community, like me, do 5 kilometres over the speed limit, that small individual risk adds up to a greater collective harm for the community. And I think that's one of the big public health prevention paradoxes we've got. And back to COVID, I mean, we are asking communities to accept a message that if you take a small vaccine, that vaccine will be good for you, but it'll also be good for the community more broadly, regardless of whether or not you get sick. That herd immunity, that protection that we provide the community. And I think low-level speeding is that vaccine, or speeding is that vaccine, or speed is that vaccine. But our challenge is, how do we convince people that a little bit of that prevention by all of us may help me, but it'll certainly help my community?
So again and again, engagement and community participation. In any case, COVID has shown us that when we don't engage properly the communities, people doesn't understand and wear the mask, people doesn't like social distancing, and they go and do the contrary. So I think there is more than, there is a lot of lesson that we can learn about what we have done with COVID that we can apply to this old problem of road safety. Jessica, I forgot to tell you before that the question you answered was from Adeline. So the question, I hope that Adeline, you are satisfied. If not, just put something in the chat if you want to dig more. There is a question for Irene and myself, and it's linked with what David and Ayan has just discussed, speed in cities. The question is asked by Innocent, and is this one. We are currently noticing change of speed limit sign from 40 kilometers per hour to 60 kilometers per hour in the city of Kigali after social media complaints. Considering that our roads are a mixed usage where car, motor, bicycle, pedestrians are using it, don't you think we are risking to have an increase in road death and injuries in Rwanda? What is the best way to deal with that? Irene?
Yes.
Go first.
Yes, we are, of course, what he said is true, but what we need, we have been emphasizing it, is just behaviors. If we are driving up to 60 kilometers per hour and we reach safely, why not can't we continue as this? So the issue is that resides in the behavior change and the community engagement, as we said. We need, what is needed is just enforcement. If we are changing from 40 to 60, that would not be an issue for the road users, because the driver are the ones who will be controlling the speed on road. So for me, my understanding is that it shouldn't be an issue, because we need to change in terms of behavior and the prevention measures. The prevention measures are in our hands, because if you are walking by foot, or if you are driving, the responsibility is yours, because we know we have a mixture of road users, pedestrian, drivers, car drivers, motorcyclists, and even bicycle drivers. So what we need is just to take control of the road and be cautious while driving, respecting all the people and all items around you while on roads. That's what can be my understanding on that. It shouldn't be an issue.
Thank you.
Thank you.
So that means innocent, if the sensitization is well done, we will not see an increase in accidents because pedestrians, people on velo, on motorbike, and car user will behave well. We will follow that. Thank you, Irene, for this insight. Ayan, there is a question that I want to direct to you. It's directed to all, and I will ask everybody. It's about driving under influence of drugs. What is your experience with that? I think David, Irene, Jessica, and all have experience in that, but I know that in your previous work, you have worked on that. So you start.
Thank you, Agnes. I think we were the 5th jurisdiction in the world to introduce drug driving legislation and the enforcement that went with that. Our experience in this country is still that the primary drug of concern, as David said, as in many countries, is still alcohol, consumed by far many more people and causing the greatest proportion of harm. But we certainly knew that we had a hidden problem and we had a problem that was emerging. People will drink alcohol, people will also take other drugs, and they will drive. And when I talk about drugs, I talk about not only illicit drugs, but prescribed drugs for medical purposes where, whether it be drowsiness or some impact on the central nervous system, will affect people's ability to drive. So we've run a lot of campaigns. We've had drug driving legislation for about 15 years. It enables our police typically now, they still test for alcohol at roadside. So we have what's called random breath testing. Police do not need a reason or a suspicion. They can stop motorists. We have what we call booze buses, where about 20 police officers, often cadets supervised by more experienced police, will create a roadblock or block one of the lanes, and they will filter traffic in and test using roadside handheld equipment. If that test is 0 or below 0.05 blood alcohol, which is our legal limit, if police have a reason to believe, or if they want to test randomly, they're also able to do a roadside saliva test, a preliminary drug test as well. Now, these are more expensive and they take a few minutes, even at roadside, to get a preliminary result. So they are used in combination, but our experience now, as we've evolved into drug testing, is that we need to maintain our primary focus on alcohol and alcohol prevention, but we do complement that with both random and targeted drug driving enforcement as well.
Thank you, Ayan. David, there is a question here I want to direct to you about the risk of substandard cars and where those risks exist. And this because many countries doesn't even know that they import substandard cars because they just look at the label of the car and believe it's the same as the one sold in rich countries.
Sure.
Go ahead.
We could have a whole webinar on that subject. It's a big subject. but you're absolutely right. And it's a particular challenge in Africa. I mean, unfortunately, across sub-Saharan Africa, very few countries, hardly any countries, are properly applying the UN framework of vehicle safety standards. And they're not applying them to new production vehicles, either produced locally or imported, or to second-hand vehicles. So there is a big, let's put this positively, a big opportunity for sub-Saharan Africa to really step forward in terms of the application of UN standard regulations, which have been in existence, many of them, for instance, the main occupant protection, front and side impact, things like that. They've been around for 25 years. So there's nothing new here. And they are readily available from the UN system for countries to adopt. I think in sub-Saharan Africa, you also have a very special problem with second-hand imported vehicles, which still make up the majority of the vehicles entering the whole continent. And the issue there is actually just as important on for environmental measures too. There needs to be better control of the vehicles that are being imported. Many countries used to import more or less anything that with a cutoff of maybe just 10 years, saying we'll import anything, but not if it's older than 10 years. Now there's a move to make that much shorter, to say nothing imported if it's 5 years old. And I think that's a good step forward. But also work being done by UNEP in Nairobi, UN Environment Programme, and the UN is encouraging as well some qualitative standards, so that when vehicles are being imported, you can check. The data shouldn't be too difficult to find. Check whether they meet the main UN standards, both for safety and environment. So it's a big issue, but there's a lot of progress that could be made.
Absolutely. And I want to insist on that. It's criminal to sell us cars that are substandard, look like the good car you sell in Europe, that are new, and we buy because we trust them.
Yep.
So it's an appeal to all African countries now. Please check them. Yep. Don't trust.
Exactly.
We are at the end of the webinar, unfortunately. It was very interesting. I have a couple of things that we will follow up. Those webinars are for actions and for follow-up. I first want to thank our panelists and participants for attending this informative conversation and for using this webinar platform to acknowledge the need of more effort for improving road safety and for increasing awareness about this challenge. We have learned something about awareness. Let's use the daily reporting nationally about all those victims of road accident of the day, like we do for COVID. It's a good idea. Thank you for bringing that in front of us. So I hope this time has been a reminder to all of us that we have to gather effort from policymakers, law enforcement, government, and public health sectors to advocate for road safety and respond to road crash injuries and death, especially for the young people and for the children who are the most affected. We have to continue to fight to keep all people safe by implementing all the good ideas that have been exchanged. This webinar is time limited, but I advise everybody to go to the Road Safety Initiative to discover more ideas. We have to build roads that have preventive maintenance measure, as Irene have said, and as Ayan have said, so that we minimize the risk of crashes. We have to involve more the communities, as all our speakers have highlighted. And in conclusion, I would also like to thank the Commonwealth Road Safety Initiative for hosting this webinar. We highly commend this initiative effort, and we are proud to working together on advocacy and on advising on improvement of law. And this has impact in the Commonwealth countries, but also beyond. The webinar recording will be disseminated on UJG channel shortly, and all the questions that has not been answered during the webinar will be answered on Twitter, Instagram, and Facebook with the hashtag Ask Professor Agnes. This brings today's session to the end. I wish all of you a nice time, whatever place you are in the world, and give you a rendezvous for next month's Ask Professor Agnes series. Thank you very much, and to follow, because there are some great ideas here that we need to follow. Thank you, David. Thank you, Ayan. Thank you, Jessica. Thank you, Irene. Thank you, the technical people. Without this was not possible. It was so well done. Thank you, Clément, Praise, Élysée, and all of you. Bye.
Thanks very much, Agnes. Well done. Great job.
Thank you.
Thank you.